Most lower back pain has a simple explanation. It just hasn't been explained properly yet. I'm a physiotherapist, and lower back pain is one of the most common things I see almost every single week in people who are otherwise healthy, active, and have no idea why their back keeps acting up. So tonight, we're going to go through it properly, slowly, one piece at a time. There's nothing to figure out right now, nothing to solve. Just listen. Before we get into the reasons, it helps to have a very simple picture of what's actually back there. Not an anatomy lecture, just enough to make everything that follows click into place. Your lower back, what we usually call the lumbar spine, is made up of 5 vertebrae stacked on top of each other, right above your pelvis. Between each of these bones sits a disc, a kind of cushion that absorbs shock and allows movement. Around all of this is a deep web of muscles and connective tissue, some of them small and close to the spine, designed for stability, others larger and designed for movement and power. And then there's the pelvis itself, which acts almost like the foundation of a house. If the foundation tilts, even slightly, everything built on top of it has to compensate. That compensation is the heart of almost everything we're going to talk about tonight. Your lower back is, in a sense, the great compensator of your body. When something else isn't working quite right, somewhere else, your lower back very often steps in to pick up the slack. It wasn't designed to do all that extra work. And over time, that's when the pain begins. So let's go through this one reason at a time. Not all at once, not as a list to memorize. Just one cause, fully explained, and then the way out of it, before we move calmly to the next. The first reason is one almost everyone listening tonight will recognize immediately. It's sitting. Not sitting itself exactly, but sitting for long, unbroken stretches of time. The way most modern lives are built around, whether it's a desk job, long commutes, or simply a few too many hours in front of a screen in the evening, prolonged sitting changes the body in a very specific, very predictable way. When you sit for a long time, your hip flexors, the muscles at the front of your hips that connect your thighs to your spine, gradually shorten. They adapt to the position they're held in most often. At the same time, the muscles at the back of your hips and your lower back tend to lengthen and weaken slightly, simply because they're not being asked to do very much while you sit. This creates what's sometimes called an anterior pelvic tilt, where the front of the pelvis drops slightly and the lower back arches a little more than it should. And that small shift in alignment puts extra pressure exactly where you don't want it, right in the lower spine. Here's the part that confuses people. The pain from this often doesn't show up while you're sitting. It shows up afterward when you finally stand up, and that first movement feels stiff, tight, almost locked. Or it shows up at the end of the day as a low background ache that's hard to pinpoint to any one moment. The fix here isn't complicated, and it's not about sitting less out of guilt. It's about interrupting long sitting stretches with small, regular movement. Standing up every 30 to 40 minutes, even just for a minute, is enough to reset that hip flexor tension before it accumulates. A short walk, even around the room, helps far more than people expect. And specifically stretching the hip flexors, something as simple as a gentle kneeling lunge stretch, held for 20 to 30 seconds on each side, can undo a surprising amount of that daily tightness. The goal isn't to eliminate sitting from your life. It's to stop your body from settling permanently into that shortened position. I think of it like this with my patients. Your body adapts to whatever position you give it the most. If you give it long, unbroken sitting, it will adapt to that quietly, without asking permission. The good news is, it adapts back just as easily the moment you start interrupting that pattern. I remember a patient, a software developer in his early 30s, who came in convinced something was structurally wrong with his spine. He'd had an MRI, everything looked completely normal, and yet every single evening, around 6 or 7, his lower back would tighten into this dull, persistent ache. When we actually mapped out his day together, the pattern became obvious almost immediately. He sat for his entire workday, 9 hours, with maybe 2 short breaks, no injury, no single dramatic moment, just 9 hours, every day, of his hip flexors slowly shortening and his lower back slowly compensating. We didn't change his job. We just added a phone alarm every 40 minutes, a simple reminder to stand for 60 seconds and do 2 or 3 hip flexor stretches. Within about 3 weeks, the evening ache had almost completely disappeared. Nothing about his actual work changed, just the pattern of stillness within it. Let's move to the second reason now, one that's closely related, but distinct enough that it deserves its own explanation. The second reason is weak or underactive glute muscles. Your glutes, the muscles of your buttocks, are actually some of the most important stabilizers for your entire lower back and pelvis. When they're strong and active, they do a large share of the work involved in standing, walking, climbing stairs, and bending. But for a lot of people, especially those who sit often, the glutes become what we sometimes call inhibited. Not necessarily weak in the gym sense, but underused, slow to activate, almost forgotten by the nervous system. When the glutes don't activate properly, something has to take over their job. And very often, that something is the lower back. The muscles along your spine, which were built for fine control and posture, end up doing heavy stabilizing work that should belong to the glutes. Over weeks and months, this creates chronic tension and fatigue in the lower back muscles, the kind of dull, tired ache that seems to have no clear trigger. You can often spot this pattern by a simple observation. If your lower back feels tight and overworked, but a gentle squeeze of your glutes feels oddly difficult, like you're not quite sure how to engage them on command, that disconnect is often part of the story. The fix is to retrain that connection. Simple bridge exercises, lying on your back with your knees bent, feet flat on the floor, then lifting your hips up by squeezing your glutes, are one of the most effective and accessible ways to wake this connection back up. Doing this slowly for 2 to 3 sets of 10 to 15 repetitions a few times a week makes a noticeable difference within a couple of weeks for most people. Clamshell exercises, lying on your side with knees bent and slowly opening your top knee like a clamshell, also help target the smaller glute muscles that are often the most neglected. What I tell people in clinic is that strengthening the glutes isn't really about building bigger muscles. It's about giving your lower back permission to stop doing a job that was never supposed to be its responsibility in the first place. There was a woman in her 40s, a teacher, who came to me convinced her glutes were simply fine because she walked regularly and felt like a generally active person. When I asked her to lie down and do a simple glute bridge, lifting her hips while squeezing, what actually happened surprised both of us. Her hamstrings and her lower back muscles took over almost immediately, and her glutes barely engaged at all. She could feel the difference the moment I pointed it out. This strange sensation of muscles that were technically there, but had become almost silent, overridden by everything around them, doing the work instead. We spent 4 weeks just on activation exercises, simple bridges and clamshells, nothing intense, before adding any real strength work. By the end of that month, she told me her lower back which had quietly ached most evenings for over a year, finally felt calm by the time she got home from work. Now let's talk about the third reason, which is one of the most overlooked because it doesn't happen in the back at all. It happens in the hips. Your hips are designed to be highly mobile joints. They're meant to rotate, flex, extend, and move through a wide range of motion every single day, whether you're walking, bending down to pick something up, or simply turning to reach for something beside you. But for many people, especially those who spend a lot of time sitting or doing repetitive movements, hip mobility quietly decreases over time, often without anyone noticing until something else starts to hurt. Here's the connection. When your hips can't move through their full range, your body still needs to accomplish the movement you're asking of it. So, it borrows motion from somewhere else, and the nearest, most willing substitute is almost always the lower back. Instead of bending at the hip to pick something up off the floor, a stiff hip forces you to round and flex through the lumbar spine instead. Instead of rotating through the hips, when you turn to grab something, a tight hip forces that rotation up into the lower back. Multiply that substitution by dozens of small movements a day, and you have a lower back that's chronically doing work it was never built to absorb. This is sometimes called the joint-by-joint approach in physiotherapy, and it's a genuinely useful way to think about your whole body. Some joints, like the hips and the ankles, are built primarily for mobility. Others, like the lower back, are built primarily for stability. Problems tend to show up when a mobility joint becomes stiff, and a stability joint is forced to become mobile instead, taking on movement it wasn't designed to control. You can often notice this yourself with a simple check. Standing up, try rotating your upper body to look behind you. First by turning from the hips and trunk together, then noticing if it feels like the movement is coming mostly from your lower back rather than spreading through your hips and torso. If your hips feel locked and most of the twisting happens right at your waistline, that's often a sign of exactly this pattern. The fix here is to restore hip mobility directly. Hip circles, done slowly and deliberately, while standing and holding on to something stable, help loosen the joint capsule. A simple 99-90 hip stretch, sitting on the floor with one leg bent in front of you and one leg bent to the side, gently leaning forward, opens up rotational mobility that tends to disappear with too much sitting. And deep, controlled squats, even just bodyweight ones, done slowly and through a full, comfortable range, are one of the best ways to keep the hips moving the way they're meant to. What I find with patients is that once hip mobility improves, even modestly, a surprising amount of lower back tension resolves on its own, simply because the back is no longer being asked to compensate for a joint that's finally doing its own job again. A patient of mine, a man who used to play competitive squash years earlier and had since become mostly sedentary, came in after a weekend of gardening had left his lower back in spasm. He assumed he'd simply pulled something. What we found instead was that his hips, after years without the rotational demands of squash, had become noticeably restricted, especially on one side. The gardening involved a lot of twisting and reaching, movements his hips could no longer fully provide. So, his lower back had absorbed all of that rotation in a single weekend instead of across years of regular movement. We spent 6 weeks working almost entirely on hip mobility, with very little direct work on the back itself. The spasms didn't return even the following spring when the gardening started again, because by then, his hips were finally doing their share of the work. There's something worth pausing on here before we go further. I am not a doctor or physician. I am a physiotherapist, This is not medical advice. Please consult a qualified healthcare professional before making any decisions about your health, especially if your pain is severe, sudden, accompanied by numbness or weakness in your legs, or hasn't improved after a reasonable amount of time. Everything we're discussing tonight applies to the common, everyday kind of lower back discomfort that affects so many people, not to every possible cause there could be. With that said, let's continue, because there's more to understand here, and more that genuinely helps. The fourth reason brings us somewhere a little less physical and a little more easy to dismiss, even though it's often hiding in plain sight. It's stress. It might seem strange that something happening in your mind could show up as pain in your lower back, but the connection is well documented and surprisingly direct. When you're under chronic stress, your body holds tension in certain predictable places, and the muscles surrounding your spine are one of the most common. This isn't pain that's imagined or exaggerated. It's real, physical muscle tension created by a very real physiological response. Here's what happens. Chronic stress keeps your nervous system in a low-grade state of alertness, sometimes called a sympathetic state, the same system responsible for the fight or flight response, just running quietly in the background rather than fully activated. One of the side effects of this state is muscle guarding, a kind of unconscious bracing where muscles stay slightly contracted, ready for something, even when nothing is actually happening. Your lower back muscles, which already carry a lot of postural responsibility throughout the day, are particularly prone to this kind of chronic, low-level bracing. Over time, muscles that are held in a state of constant low-level tension become fatigued, tight, and far more sensitive to pain. This is part of why stressful periods in life so often line up with flare-ups of back pain that don't seem to have any clear physical trigger. Nothing necessarily changed about how you're moving or sitting. What changed is how much tension your body is quietly holding on to. The fix here works on two levels. The first is addressing the tension directly through things like deep, slow breathing exercises, which physically reduce that sympathetic nervous system activation. Even 5 minutes of slow, deliberate breathing in through the nose for a count of 4, holding briefly, and out through the mouth for a count of 6 can measurably lower that background muscle guarding. The second is addressing the broader stress itself, whether that's through better sleep, regular movement, or simply identifying what's actually driving the tension in the first place. I tell my patients this often. Sometimes the most effective treatment for back pain isn't a stretch or an exercise at all. It's giving the nervous system permission to stand down. I worked with a woman going through an unusually demanding period at work, managing a major project with constant deadlines. Her lower back pain had started gradually around the same time the project began, and by the time she came to see me, it was a near constant low-grade ache. Worse some days, better on others, with no clear physical pattern to explain the fluctuation. Her posture was reasonable, her hips moved well, her glutes activated properly. Physically, very little was actually wrong. What we eventually traced it back to was almost entirely tension, a body that had been quietly braced for months. We didn't change anything about her exercise routine. We focused on breathing work and short walks specifically without her phone, just 10 minutes, twice a day. The project ended about 6 weeks later, and so, almost immediately, did the back pain, confirming what we'd both suspected the whole time. Let's move now to the fifth reason, and this one connects beautifully to exactly what we're doing together tonight. The fifth reason is sleep, and more specifically, how and where you sleep. Your spine spends roughly a third of your life in whatever position your mattress, and your sleeping habits put it in, which makes this one of the most overlooked factors in chronic lower back pain, simply because it happens while you're unconscious and can't notice it happening. There are two parts to this. The first is the mattress itself. A mattress that's too soft allows your hips, which are the heaviest part of your body, to sink down further than your shoulders and legs, putting your spine into a curved, unsupported position for hours at a time. A mattress that's too firm does the opposite, failing to allow your hips and shoulders to sink in at all, which can create pressure points and force your spine into an unnaturally straight, tense position. Neither extreme is ideal. What your spine actually needs is support that keeps it in something close to its natural neutral curve, regardless of which position you sleep in. The second part is sleeping position. Sleeping on your stomach is the position most likely to aggravate the lower back because it typically forces your head to one side for hours and creates an exaggerated arch in your lumbar spine, especially if your mattress doesn't offer much support. Sleeping on your back with a small pillow placed under your knees tends to be one of the gentlest positions because it allows the natural curve of your lower back to be supported rather than exaggerated. Sleeping on your side with a pillow placed between your knees keeps your hips, pelvis, and spine in a more neutral alignment, which is often the most comfortable option for people who already deal with lower back tension. What's interesting here is that this isn't really about finding the one perfect sleeping position, because most people shift through several positions during the night anyway. It's more about giving your spine the best possible starting conditions and removing the specific patterns, like stomach sleeping on a soft mattress, that tend to make things worse over time. A patient once came to me with morning back pain that was almost the opposite of what I usually see. Most people feel worse in the evening, after a long day of activity, but his back felt fine all day and then woke him up, stiff and sore every single morning. It turned out he'd been sleeping on his stomach for as long as he could remember, on a mattress that was years past its prime and had sunk noticeably in the middle. Every night, for roughly 8 hours, his lower back sat in an exaggerated arch with his hips sinking lower than the rest of his body. We didn't ask him to completely retrain his sleep position overnight, since that rarely works and tends to disrupt sleep itself. Instead, we started with a thin pillow under his hips when he was on his stomach, which slightly reduced that arch, alongside a gradual transition towards side sleeping with a pillow between his knees. Within a few weeks, those morning aches had faded considerably, simply by changing what his spine experienced during the hours he wasn't even aware of it. If you've made it this far tonight, here's a small thought to carry with you. As you drift off, your body is doing exactly what we've been describing this entire time: settling, adjusting, finding whatever position causes the least resistance. There's nothing to actively do about any of this right now. Just let your body continue settling, the way it already knows how. Let's continue gently into the sixth reason, which is one that surprises a lot of people, because it isn't about doing too much, it's about doing too little, spread across the whole day. The sixth reason is general sedentary patterns, and this is distinct from the sitting we talked about earlier, because it's not really about any single long stretch of sitting. It's about the overall amount of movement your body gets across an entire day. Someone can go to the gym for an hour and still spend the other 15 waking hours barely moving at all, and the body responds to that overall pattern, not just to the hour of deliberate exercise. Your spine and the muscles supporting it rely on regular, varied movement throughout the day to stay nourished and mobile. The discs between your vertebrae don't have a direct blood supply the way most tissues do. Instead, they rely on movement to pump fluid in and out, a process that brings in nutrients and removes waste. When the body stays still for very long stretches, even outside of formal sitting, that pumping action slows down considerably, and the tissues around your spine become slightly less resilient over time. This is part of why someone can feel relatively fine on an active weekend, full of walking and movement, and then feel noticeably stiffer and more achy after a quiet day spent mostly on the couch. Even though nothing was technically strained or injured, the lower back, more than almost any other area, seems to respond to total daily movement volume, not just to specific exercise sessions. The fix here isn't about adding more intense exercise, and it isn't about feeling guilty for resting. It's about spreading small amounts of movement more evenly across your day, standing up periodically, walking to get water, taking calls while pacing instead of sitting, even just shifting positions every so often. None of this needs to be strenuous. The goal is frequency, not intensity. A short walk after each meal, even just 5 or 10 minutes, tends to have a noticeably positive effect on lower back stiffness for a lot of people, simply because it interrupts long stillness with gentle, repeated motion. What I tell people in clinic is that movement is something your spine needs in small, frequent doses, almost like a nutrient, rather than something to be saved up and delivered all at once during a single workout. I had a patient, a man in his late 50s, who was genuinely confused by his own pattern. He went to the gym religiously, 4 mornings a week, strength training, nothing reckless, well within his ability. And yet, his lower back felt progressively stiffer as the years went on, despite, in his words, doing everything right. When we looked closer at the rest of his day, the picture filled in. He worked from home in a job that required very little movement, and outside his gym sessions, he genuinely sat almost the entire remaining day, often without realizing how long stretches had passed. His body was getting 4 excellent hours of movement a week and roughly 70 hours of near stillness. We didn't touch his gym routine at all. We simply built in movement breaks throughout his workday. Short walks, standing stretches, nothing structured. 3 months later, his stiffness had measurably improved, not because of anything happening in the gym, but because of everything happening, or finally, not happening, outside of it. Now, the 7th and final reason we'll go through tonight, and this one ties together a lot of what we've already discussed. The 7th reason is structural muscular imbalance, meaning one side of your body has quietly become stronger, tighter, or more dominant than the other, often without you ever noticing it happening. This is extremely common, and it usually develops from small, repeated daily habits rather than anything dramatic. Always carrying a bag on the same shoulder, always crossing the same leg when sitting, favoring one side when standing for long periods, shifting weight onto one hip without thinking about it. None of these individual habits seem significant on their own, but repeated thousands of times over months and years, they create real, measurable asymmetries in muscle tone and flexibility. When one side of your body becomes tighter or stronger than the other, your pelvis can sit very slightly rotated or tilted, even if it's not something you'd notice just by looking in a mirror. And once the pelvis is even subtly out of alignment, the lower back has to make constant small adjustments to keep you balanced and upright. Adjustments that, over time, create uneven tension, fatigue, and eventually, pain. Very often concentrated more on one side than the other. You can sometimes notice hints of this yourself. Pain that's consistently on one side rather than centered. A bag strap that always seems to slide off one shoulder more than the other, simply because that shoulder sits slightly lower. A sense that one hip feels tighter than the other when you stretch The fix involves becoming aware of these small, repeated habits and consciously varying them. Switching which shoulder carries a bag, alternating which leg you cross, being mindful of standing with weight distributed evenly on both feet, rather than always leaning into one hip. Beyond awareness, exercises that specifically challenge each side independently, like single-leg glute bridges or single-leg balance work, help identify and correct asymmetries that bilateral exercises tend to mask, because the stronger side often just compensates for the weaker one without you realizing it. I find this is often the most satisfying reason to address, because once people become aware of these small asymmetric habits, the fix is almost entirely about awareness and small adjustments, rather than anything that requires significant time or effort. A young mother once came in with pain concentrated almost entirely on her left side, which struck her as strange because, as far as she could tell, she hadn't done anything different on that side. After a bit of conversation, the pattern became clear. She carried her toddler almost exclusively on her left hip, every single day, sometimes for long stretches, simply because it had become an unconscious habit from early on. That repeated asymmetric load had gradually shifted her pelvis, tightened her left side, and left her right side comparatively underused. We didn't ask her to stop carrying her child, which obviously wasn't realistic. We simply worked on consciously alternating sides, along with some single-leg strengthening work to balance things out. Within 2 months, the one-sided pain had become far more centered and mild, simply by no longer asking one side of her body to do all the work every single day without ever sharing the load. There's an 8th reason worth going through tonight, one that connects the ground all the way up to the lower back in a way that surprises most people the first time they hear it. The 8th reason is footwear, and specifically, what happens underneath your feet. It might seem like an unlikely place to look for an explanation of back pain, but your feet are the very first point of contact between your body and the ground, and whatever happens there travels upward through your entire kinetic chain, through your ankles, your knees, your hips, and eventually your lower back. Worn-out shoes, particularly ones that have lost their support in the heel or arch, change the way force travels up through your legs with every single step. Flat, unsupportive footwear, or shoes that don't match the natural shape of your foot, can subtly alter your gait, the way you walk, often without you noticing any difference at all in the moment. Over thousands of steps a day, even a small alteration in gait creates a small, repeated, asymmetric load that eventually has to be absorbed somewhere further up the chain. Very often, that somewhere is the lower back. This becomes especially relevant for anyone who spends long hours standing, whether that's a job on your feet all day like retail or healthcare work, or simply a lot of time spent standing in the kitchen, at events, or moving around a workspace. Standing for extended periods on hard surfaces, especially in shoes that don't offer much support or shock absorption, places sustained, repetitive stress through the legs and into the lower back. The fix here starts with simply paying attention to your shoes. Footwear that's worn down unevenly, especially on one side more than the other, is often a visible clue that something in your gait has shifted. Replacing shoes that have lost their support, choosing footwear with adequate arch support for your specific foot type, and avoiding very flat, unsupportive shoes for long periods of standing all help reduce this upward chain of stress. For anyone who stands for long stretches at work, a supportive insole or an anti-fatigue mat, if that's an option, can make a meaningfully noticeable difference over the course of a full shift. I once worked with a hairdresser who'd been in the profession for almost 15 years, standing on a hard salon floor for the vast majority of every single workday. Her lower back pain had become so gradual and constant that she'd almost stopped noticing it as pain at all, more just a permanent background feature of her job. When we looked at her shoes, they were years old, completely flattened through the arch, worn unevenly along the outer edge of each sole. We didn't change anything about her actual work. We simply replaced her footwear with properly supportive shoes designed for all-day standing and added a cushioned mat at her station. Within a month, she described her evenings as feeling, in her words, like she'd gotten her legs and her back back. Something as small and overlooked as a pair of shoes had been quietly contributing to years of discomfort. There's a ninth reason, and it's one of the most misunderstood, because it involves a muscle most people have never consciously felt working at all. The ninth reason is a weak, deep core, and specifically, the transverse abdominis, a deep abdominal muscle that wraps around your torso almost like a natural weight belt. This is different from the abdominal muscles people usually think about, the ones closer to the surface responsible for visible definition. The transverse abdominis sits underneath those muscles, and its primary job isn't movement at all. It's stabilization, creating tension around your spine before you even begin to move, almost like your body's own internal bracing system. A lot of people have reasonably strong superficial abdominal muscles, particularly if they do sit-ups or crunches regularly, while their deep core remains comparatively weak and underdeveloped. This creates a strange situation where someone can look strong through the midsection and still experience significant lower back instability, because the muscle actually responsible for protecting the spine during everyday movement was never properly trained in the first place. When the deep core isn't engaging properly, your spine loses some of its natural stability during everyday movements, bending, twisting, lifting, even just standing up from a chair. The lower back muscles once again end up compensating for this missing support, working harder than they should to create stability that should be coming from deeper, more centrally located muscles. You can sometimes get a sense of this yourself. Try gently pulling your belly button in toward your spine without sucking in your stomach or holding your breath. Just a subtle inward draw. If that motion feels difficult to find, or if you naturally hold your breath to do it, that's often a sign this deep stabilizing system isn't being used the way it should be. In daily life, the fix involves specific exercises designed to engage this deep system, rather than the more visible abdominal muscles. Simple exercises like the dead bug, lying on your back with arms and legs raised, then slowly lowering opposite arm and leg while keeping your lower back gently pressed into the floor, are excellent for this. Planks, done with proper form and without letting the lower back sag, also recruit this deep stabilizing system effectively. The key in all of these is quality over intensity, slow, controlled engagement rather than fast, effortful repetitions. A patient of mine, a fitness enthusiast who genuinely trained hard and had visible abdominal muscles, was confused about why his lower back kept bothering him during deadlifts and heavy lifting, despite what looked like a strong core from the outside. When we tested his ability to engage his deep core independently, without his surface abdominal muscles taking over, it became clear he'd never actually learned to use that deeper system at all. He built visible strength while leaving his spine's actual support system almost completely untrained. We spent several weeks on basic deep core activation, exercises that felt almost embarrassingly simple compared to his usual training, before reintroducing any heavy lifting. The difference, once he relearned how to engage that deep system before lifting, was immediate and significant. There's a 10th reason worth mentioning tonight, one that applies to a specific but very common life stage and it's one that often goes unexplained at exactly the moment people need the explanation most. The 10th reason is pregnancy and the postpartum period. During pregnancy, the body goes through a remarkable series of changes in a relatively short window of time, and several of them directly affect the lower back. As the baby grows, the center of gravity shifts forward, and to compensate, many people naturally develop a more pronounced curve in their lower back, an exaggerated lumbar lordosis, simply to keep their balance upright. At the same time, the body releases a hormone called relaxin, whose job is to gently loosen the ligaments around the pelvis in preparation for childbirth. This is exactly what the body needs it to do, but a side effect is that the joints supporting the lower back become looser and less stable than usual for months at a time. This combination, a shifted center of gravity plus loosened supporting ligaments, is part of why lower back pain is so common during pregnancy, and it doesn't necessarily disappear the moment the baby is born. The postpartum period brings its own set of demands, frequent bending and lifting to pick up an infant, often from awkward positions, disrupted sleep that limits recovery time, and core muscles, particularly that deep transverse abdominis we talked about earlier, that have been significantly stretched and need time and specific work to regain their stabilizing function. The fix during pregnancy itself usually centers on gentle, pregnancy-safe strengthening, particularly for the glutes and the deep core, along with supportive measures like a maternity support belt for some people, and very deliberate attention to lifting mechanics, bending at the knees rather than the waist. In the postpartum period, the priority shifts to gradually and gently rebuilding that deep core strength, often starting with very basic breathing and activation work before any more demanding exercise, combined with practical adjustments like raising a crib mattress to a comfortable height or using a chair with good back support during the long hours of feeding. I worked with a woman roughly 4 months after her second child was born, dealing with lower back pain that, she told me, felt different from anything she remembered after her first pregnancy. Her core was noticeably weaker than she expected, and a closer look revealed some separation in her abdominal muscles, something called diastasis recti, which is extremely common after pregnancy, and meant her deep stabilizing system simply wasn't engaging the way it once had. We started with very gentle breathing and activation exercises, nothing that resembled a typical workout, gradually building toward more substantial core work over about 10 weeks. By the time we finished, not only had her back pain resolved, but she described feeling more physically capable than she had at any point since before her pregnancy. The 11th reason is simply age, or more precisely, the gradual changes that happen naturally within the discs of your spine over time. This isn't something to be alarmed by, and it's worth explaining clearly, because the language often used around it tends to sound far more frightening than the reality actually is. As we get older, the discs between our vertebrae naturally lose some of their water content, becoming slightly less plump and slightly less able to absorb shock the way they did decades earlier. On an imaging report, this is often described with words like degeneration or wear, language that, understandably, alarms a lot of people the first time they read it about their own spine. But here's the part that almost never gets properly explained. These changes are an extremely normal part of aging, present in the majority of people over a certain age, regardless of whether they have any pain at all. Studies scanning the spines of people with absolutely no back pain still find these same disc changes in a very large proportion of them. The changes themselves are common findings of a normal aging spine, not necessarily the explanation for any particular pain. What actually matters more than the disc changes themselves is how well the muscles surrounding the spine are able to support and stabilize it, regardless of age. A well-supported spine, even one with completely normal age-related disc changes, can function comfortably and painlessly for decades. This is part of why two people in their 60s can have remarkably similar findings on a scan, and yet one experiences no pain at all, while the other deals with chronic discomfort. The difference very often comes down to the strength and coordination of the surrounding muscular system, the very things we've spent tonight discussing. The fix here isn't about reversing a natural process, because that was never the goal in the first place. It's about ensuring the muscles supporting your spine remain strong, coordinated, and well used, so that the spine itself, discs included, continues to function well despite the entirely normal changes happening within it. I had a patient in his late 60s who came in deeply worried after a scan described moderate disc degeneration at 2 levels of his lower spine. He'd convinced himself, before we even spoke, that his back was essentially wearing out and there was little to be done. After explaining how common these exact findings are in people of his age with no pain whatsoever, and after assessing his actual physical capability, his hip mobility was excellent, but his deep core and glute strength had quietly declined over the years. We built a simple, consistent strengthening program focused on exactly those areas. Within 2 months, his pain had substantially improved, even though the scan, if repeated, would have shown essentially the same disc findings as before. The scan hadn't changed. What had changed was how well his body was supporting what was already there. There's a 12th and final reason worth understanding tonight. One that's purely mechanical and easy to overlook because it's so often framed only in terms of appearance rather than how it actually affects the spine. The 12th reason is excess weight carried around the abdomen. This isn't about aesthetics at all. It's about basic mechanics. Extra weight concentrated at the front of the body shifts your center of gravity forward, very similarly, in fact, to what happens during pregnancy, which we discussed a little earlier. To compensate for that forward shift and stay balanced, the lower back naturally arches more than it would otherwise, increasing the curve of the lumbar spine and placing sustained extra pressure on the joints and discs in that area, hour after hour, day after day. Beyond the postural shift, additional abdominal weight also increases the overall mechanical load the lower back has to support throughout ordinary daily activities. Simply standing, walking, bending, and lifting all become slightly more demanding tasks for the same muscles and joints we've discussed all night. None of this is about blame or appearance. It's simply about understanding an additional mechanical factor that, when present, tends to compound everything else we've gone through tonight, since a spine already compensating for tight hips, weak glutes, or a stiff core has even less margin to also compensate for a meaningfully shifted center of gravity. The fix here isn't a quick or dramatic one, and it isn't really separate from everything we've already discussed. Gradual, sustainable weight loss through a combination of nutrition and the kind of regular varied movement we talked about earlier tends to reduce lower back strain meaningfully over time. Importantly, this works best in combination with, not instead of, the muscular strengthening we've covered tonight, since a stronger core and stronger glutes help the spine manage whatever load is currently present, even while broader changes are still in progress. I worked with a man in his early 50s who'd struggled with intermittent lower back pain for years, always assuming it was simply related to a physically demanding job he'd had decades earlier. When we looked at his overall picture, including a noticeable increase in weight concentrated around his midsection over the previous several years, a clearer pattern emerged. His posture showed a pronounced forward lean and an exaggerated lower back arch, consistent with that shifted center of gravity. Rather than focusing on weight loss in isolation, which can feel overwhelming and abstract, we focused first on strengthening his deep core and glutes, giving his spine better support for the load it was currently managing, while he separately and gradually worked on broader lifestyle changes with his physician. Over about 6 months, as his weight gradually decreased and his core strength increased in parallel, his back pain became progressively less frequent until it had essentially resolved. We've gone through 12 real common reasons tonight, each one with its own simple way forward. Before we close, there's one more thing worth understanding, something I see almost as often as the original causes themselves. Not a new reason for the pain, but a pattern in how people respond to it, one that quietly gets in the way of actually getting better. The most common mistake I see, by a wide margin, is complete rest. When the lower back hurts, the instinct for almost everyone is to stop moving entirely, to lie down to avoid anything that might aggravate it further, sometimes for days at a time. It feels like the responsible thing to do, the cautious choice. But for the vast majority of common, everyday lower back pain, the kind we've been discussing tonight, complete rest tends to make things worse, not better. Muscles that already needed more movement, not less, become stiffer and weaker during prolonged inactivity. The research here has been remarkably consistent for decades now. Gentle, continued movement within a comfortable range almost always leads to faster recovery than strict bed rest. The body heals through movement, not despite it, in almost every common case of mechanical back pain. The second mistake is the opposite extreme, pushing through pain too aggressively, trying to stretch or exercise it away in one intense session, as though enough effort in a single sitting could undo months or years of an underlying pattern. This often leads to a flare-up that feels like a setback, when really it was simply too much, too soon. Recovery from any of the patterns we discussed tonight is gradual, built through small, consistent, repeated actions over weeks, not through one determined burst of effort. The third mistake is focusing only on the location of the pain rather than the cause behind it. Someone with lower back pain caused primarily by tight hips can stretch their lower back directly for months with very little lasting improvement, because the actual source of the problem was never addressed. This is part of why working through possible causes the way we did tonight matters so much more than simply treating the symptom in isolation. The fourth mistake is inconsistency, doing the right exercises for a few days, feeling better, stopping, and then being surprised when the pain gradually returns weeks later. The body responds to patterns repeated over time, not to occasional bursts of correct behavior. Most of what we discussed tonight, whether it's hip mobility, glute activation, or deep core engagement, requires weeks of consistent, gentle practice before the underlying pattern actually shifts. And the fifth mistake, perhaps the most understandable one, is waiting too long to seek guidance when something doesn't improve. Most common lower back pain does resolve with the kind of approaches we've gone through tonight, but pain that's severe, that radiates down a leg, that comes with numbness, weakness, or doesn't improve after several weeks of consistent effort, deserves a proper evaluation from a qualified professional rather than continued self-management alone. If there's one thing I'd want you to carry with you as you drift off tonight, it's this. Your lower back is very rarely broken. It's very often simply overworked, asked to compensate for something else that isn't doing its job, somewhere else in the body. Once that underlying reason is found and gently addressed, The pain that felt so persistent and confusing usually finds its way to quietly settling down, the same way you're settling down right now. This has been educational content, not medical advice. Sleep well and take care of yourself.